2006, I worked in the rehab institutes for 4 years, I think from 2001 to 2005, and then moved to the UK. I worked initially as an OT here, and then I've moved into management and research. And currently I work in London 2 days a week, where I work for an institute called the National Institute of Health Research that funds applied health research. And I'm part of the capacity building team at work there. And I also am a PhD student at the University of Oxford, researching how carers of people with dementia use technology to support them to live for longer at home, and what their experience and impact of using technologies on those carers. And part of my research is on mixed methods. I use both qualitative and quantitative methods, and part of my research is also on how to bring those two methods together. So my talk today is going to be on qualitative research and a very basic introduction to qualitative research. What I'll try and do is start very broadly, give you some examples of qualitative research, why is it important, etc. And then I'll move on to much more narrower areas, which I'm more comfortable talking about because it's part of my research and I actually know what I'm talking about. So I'll talk about how to collect data. I'll also talk about how to analyze qualitative research as well. So that's what I'll try and do over the course of the next hour or so. I also like very interactive teaching sessions. So I've tried to make this slightly interactive. I don't know if it'll work or not, but I'm sincerely hoping it'll work. So we'll use a website called Menti. I'll give you the instructions on how to log in there. So if you're on a computer, you can just open it up in another browser of your, you can use your mobile phone, etc. So we'll try and make it slightly more interactive. And there's one exercise where we'll divide into smaller groups as well. So we'll put you into smaller groups so you can have a bit of a discussion and then come back to the main group and then sort of share your thoughts and ideas as well. So I'll try and make this interactive. Might look and seem very strange because we're doing it all online, but it works really well normally. So let's hope it works that way as well. What I'll do is I'll start sharing my screen. I'm going to turn off my video so I can actually look at my screen slightly better instead of looking like a weird looks on my face when I'm trying to focus on the screen. So I'm going to stop my video but start sharing my screen. If you have any questions, if anything is not clear, unmute yourself and shout out. This is not like a formal teaching session or anything. It's much more information sharing than anything else. So please feel free to do that. Okay, I'm just going to share my screen. I'm assuming you can see. Reema, someone has to tell me.
Yes, sir.
Okay.
Yes, sir. The screen is seen.
Thanks for that. So what I'm going to do today is to give you, like I said, a practical outline for qualitative research. I'm not going to go into lots of philosophy and theory behind qualitative research because that takes a much longer time to get those messages across. So I'm going to just talk a little bit more practically in terms of what qualitative research is, what sort of questions you can answer using qualitative research, and also how to analyze, and finally give you some pointers on how to write that up if you want to write that up as publication or as part of your project or thesis or dissertation, etc. So that's what we're going to try. I did mention wanting to use being interactive. So let's try and use something called as Menti. I'm going to stop sharing my screen for a second and then bring up a slide website. Sorry for that. So if you go to, let's start presenting. I'll share my screen again. If you have another screen, or you can use your phone, if you go to this website called www.menti.com that you can see on my screen and use the code 204132, it should bring up this question on your screen and then start answering that for me. Just use one word and say which city you're currently in. Okay. Cool. Got lots of people from Vellore. There's a little number on the side tells me who has answered. So about 12 of you have answered out of a total of 29, excluding me. Somebody has said India. I didn't know India was a city. I'm going to give 30 more seconds and then move on. Any other cities represented in this call? Okay. I will stop screen share again. Cool. That sort of gives you an idea of how to use Menti. We'll be using this as we go along. So you just sort of get you to interact a little bit more and try and answer a few questions as we go along. So I'm going to start sharing my screen for my slide deck again. Okay, so this is the next question that we're hoping that you can answer. How do you describe qualitative research? So we'll go back to Menti again and try and answer that question. If someone, Reema or someone can tell me whether you can see the screen again. Can you see the screen? The question is, how would you describe qualitative research? And you can use more than one word.
Yes, sir. I can see the screen.
Oh, brilliant, brilliant. Thanks for that. So what is your understanding of qualitative research? Okay. Okay, good. There's a decent definition of qualitative research. Observation-based, okay. Any other answers? Ooh, someone says subjective assessment, okay. Research involving experience of individuals, interviews, non-numerical, doesn't vary with the number much, okay. Description of events, research which cannot be measured in numbers, okay. 30 more seconds and then we'll move on. Okay, that's a very nice definition. Qualitative research is the opposite of quantitative research. Okay. It generates deeper knowledge of the subject. Decent answers. I'm not going to say whether they're all right or wrong, but it just sort of gives you a flavor for what we think qualitative research is and what we think it is not. So lots of us have actually said, oh, it's nothing to do with numbers. It's much more subjective. People have also said it's, it's based on interviews. So interviews, one mechanism of doing qualitative research, but that's not the be all and end all for qualitative research. So I'm going to show you what sort of roughly is the definition of qualitative research and how it actually can involve numbers as well, depending on the research question that you're asking, and more importantly, what sort of methods you're using to do the research. Now, qualitative research, like some of you mentioned, is about applying it to the what, how, and why questions. It is iterative, so that's the key to qualitative research, because you come back and revisit the questions again and again, and then make an interpretation of what you've learned, and then you can use that to build theory or answer the questions that you have in terms of hypothesis. It is typically employed in the collection and analysis of non-numerical data, so someone mentioned that, so that is partly correct, but you can also use qualitative research in a quantitative way. I'll come to that in a minute. It is usually exploratory in nature, so somebody mentioned that, and it also seeks to generate novel insights. So you can actually find out things through qualitative research that nobody else has researched. So that's another nice way of doing, describing qualitative research as well. You could have inductive qualitative research. So you actually start observations and then you develop a hypothesis of why certain things are happening. Or it could be a deductive approach as well. So you start with a hypothesis and you test to see whether that is proved or not proved. So you know, the whole quantitative thing of a null hypothesis and whether you're proving or disproving it, you can do it with qualitative research as well. But for the most part, it helps you sense make what is happening. So somebody's life experience or somebody's experience of healthcare, somebody's experience of pain, somebody's experience of quality of life. To understand all of that, qualitative research is a very good mechanism. It's mostly applied to understanding social processes. So, you know, why do certain people behave in a certain way? You can also understand why people interpret the world around them in a certain way and what are their beliefs and value systems. So, you know, why people enjoy going to university, or why people don't like pain, or why do people prefer a certain drug or treatment. So you could use all of that as questions for qualitative research. Usually
excuse me, sir.
Yeah.
Are you sharing your screen? We are not able to see.
Oh, sorry. I thought I was. Okay, hold on. Let's start again. Apologies, Reema. Tell me if you can see now.
Yeah, it's there now. Yes, yes.
Okay, sorry. So I was saying it's helpful to understand social processes. It was traditionally used in social sciences, but it's now become a mainstay of research methodology within healthcare as well. There's been some debate about whether qualitative research is better or quantitative research is better. People have now come to the understanding that different types of questions require different research methodology, and qualitative research is equally important and valid. A lot of the randomized controlled trials, which is seen as the gold standard for quantitative research, now include elements of qualitative research because that helps you contextualize where the research is happening, what is happening, and how to interpret those results within the context of the impact that your research is expecting to make. So it's important to understand that it is not standalone research anymore. It's part and parcel of good research methodology in healthcare. The old definition of qualitative research used to, or the old bias towards qualitative research used to be that it's subjective, it's anecdotal, and hence unreliable. It's what 1 or 2 people are saying or 10 people are saying, so you can't actually generalize it to the bigger population. One thing that people have to understand is qualitative research doesn't aim to generalize things. It aims to transfer things. So you learn something from one particular concept, context, or you're learning something from one particular group of people. You're trying to see whether that learning can be transferred to another setting. And that's what qualitative research helps you do. And that's why the merit for the qualitative research is as well. But now, especially in like mixed methods research, where like I was telling you about randomized controlled trials now using an element of qualitative research added to them, it helps you answer questions slightly differently and helps you make better impact with the research that you're trying to make. And the choice of method that you're using to answer your question might depend on the reason you're doing the research or the theoretical stance. So some research is much more easier to answer a research question using quantitative methods, but like observational data or randomized controlled trials or complex trials or crossover trials, etc. But there are some bits that you actually, especially if it's exploratory or if there's not enough known about a particular concept, it's better to start with the qualitative research and then do a quantitative element. So that's why the mixing of methods comes in. And some people in the Menti, people are saying that it's not statistical or it's not numerical, but there can be qualitative data that can be coded and summarized statistically. So there's one particular element of qualitative research, which is discourse analysis, where you actually analyze what language people are using and how they're interpreting it. So you can actually use that in a quantitative way. So I did prepare a Menti for that as well, as long as it's not too irritating for people as I switch between screens. I'll try one more Menti exercise. Okay, I'll share my screen again. So you have a question on Reema, if you can confirm, you can see the Menti screen again?
Yes, sir.
Brilliant, thank you. So use one word to describe your situation because of COVID-19. So let's take a few seconds to think, and then if you can answer that, confined, okay. Yes, okay. Okay. Any more? If you agree with another word that's on there, add the same word again. Okay. Okay, scary, inconvenient. Okay, so what in essence we're doing now is collecting qualitative data. We're asking your lived experience, what you think is happening as a result of the situation because of COVID-19, the restrictions and the problems that you've encountered, etc. But I didn't phrase it as negative or positive. I just wanted you to describe as a situation. Hence why you've answered this way. So this is called a word cloud. So the bigger the word, more people have answered it. So this word stressful, more than one or two people have answered by saying stressful. So you can quantify this and say like a larger proportion of people are finding it stressful. You can also quantify it by looking at the emotions. So the emotion of, say, negative emotion, things like stressful, exhausting, overworked, bad, they're all negative emotions. You can count all of that up and say, in the sample size of, say, 13 people, which is a very small sample, more number of people or X number of people are actually thinking the situation because of COVID is negative compared to one or two people who might be actually saying bliss or unchanged. So there could be neutral emotions or positive emotions because of the situation. So you can actually quantify qualitative data as well. So there's one particular methodology that allows you to do that. So it doesn't necessarily always follow that qualitative data cannot be quantified. And quantitative data is qualified as well in some senses. So if you're using, categories within survey, for example, you're actually quantifying that as well. So you actually end up doing that. So you can have qualitative data in quantitative studies, and you can also have quantitative in qualitative studies as well. So I've shared my screen again. Sorry, Reema, can you confirm?
Yes, sir, it's visible.
Okay. Thanks for that. So what sort of questions can qualitative research help you answer? It can answer questions like, what is a particular thing? So, you can answer questions like, what is the experience of someone with hip fracture? What is the experience of someone with stroke? What is the experience of someone with dementia? What is the experience of someone with mental health condition? So you can answer those type of questions, but you can also answer questions, what are the different types or subclasses of something? So you can answer questions like, is there a difference between men and women who experience mental health disorders in India, for example? So you can answer that type of questions as well. You can also answer questions like what might influence something or what variables are important. So things like, if you're working in pediatrics, you can say, does going to normal school help someone with autism spectrum disorder, for example? So that might be a qualitative question as well. And for some of those questions, it's easier to do it in a qualitative research methodology rather than in a context research methodology, simply because the ethics of doing certain things won't be allowed in a quantitative method. But in a qualitative method, you can make it exploratory and try and find those answers. You can also find out things like what's people's understanding of certain things. So you're going to a normal population like we did now and asking them about what is their understanding about lockdown restrictions because of COVID. So you can answer those type of questions as well. What the qualitative research won't help you answer is the questions of how prevalent a particular condition is, or how does one particular thing affect why. So you can't do like causality type studies with qualitative research. And you can also not do prediction studies or modeling studies. So those sort of questions are not best answered by qualitative research. They are best answered by quantitative research. This is a simple generic model of a research process. This applies both to quantitative and qualitative research. So I'm going to spend a minute explaining what this means and then show you how it is interpreted from a qualitative framework. So you identify something that you want to research on. So the first step, and then you actually focus your research questions. So you find what are the questions that you want answered. And then you find out what is the sample you want. You calculate the sample size if it's a quantitative research, and then if it's a qualitative research, you also find the context for study. So are you going to research in India, or are you going to do worldwide? Are you going to do in men or women, or are you having children or adults? So those sort of questions are answered in the third step. In the fourth step, you actually collect the data. So in qualitative research, you can use different types of data collection methods, which I'll come to in a minute. In quantitative, you could do survey or observation data and then make those data, you collect data that way. And then there is the next step is you analyze and interpret that data. And if you actually look at how data, even in quantitative studies, is interpreted, there's a little bit of qualitative element to it. There's lots of people now talking about, how p-values no longer are as important as it was considered before. And then you can write up and then disseminate findings. So whatever research you're doing, you want other people to benefit from that. So you actually want to write that up and help disseminate the findings. So this is the generic model for research. In qualitative research, I don't know if you remember me mentioning it being iterative. So you have the phenomenon of interest. So you look at relevant literature and theory and then identify, okay, what do I want to research? And then you use, again, literature and theory, try and find out what other people have done, what is known, what is not known, to narrow down your research question. And then you also can use literature and theory to define your sample. What have other people done? What sort of samples have they looked at? So somebody has researched, say, on the elderly, and they've researched on men and women, and you want to find out how it affects, say, their children, so the next generation. So the research context and the literature will help you identify how to narrow down your samples and sample size, etc. The literature and theory also informs how you analyze and interpret your data in qualitative research. So it actually gives you clues on what steps to use when you're analyzing data. So I'm going to talk very specifically about one particular data analysis in qualitative research called thematic analysis. So I'll come back to that in a little while. The analysis and interpreting of data in qualitative research also ends up adding to the theory. So the next time a similar question is used, the next researcher or you, if you're carrying on your research further, can actually identify the phenomenon better, and also you can focus your research question slightly differently. In some aspects of qualitative research, you actually, when you come to the analysis and interpretation of data, because the way that you're interpreting your data, you might want to go back and check whether it's still answering your research question. And if it's not entirely answering your research question, you come back and change the sample. So this is something that you would not be allowed to do in a good gold standard randomized control trial. For example, you've written a protocol, you want to stick to the protocol and not change anything in the protocol. So you would actually end up collecting unwanted or non-useful data in a way. Whereas qualitative research, the methodology allows you to go back and re-specify your questions, recheck what answers you want from those questions, and vary or change the sampling if needed. So there's a particular method that allows you to do that. It's called theoretical sampling. I'll give an example of that later on as well. There are different types of qualitative research. So again, in my first Menti question, people mentioned interviews. Interview is the most common and most well-known technique for doing qualitative research, but you have other types of qualitative researches as well. So you have ethnography, where you actually observe and be participatory in the field that you're doing research in. Ethnography was used lots in anthropological research. So if you want to identify, how a particular group of people in a village live and experience healthcare, you actually go and spend time with them. You end up being part of that village community, spend a day or a week or a month, depending on your research question, and try and understand what their experience is by making observations. You can also do case studies. So it could be a narrative case study. It could be like historical about a patient that you've seen. It could be longitudinal case study. So if you're doing an observation of a particular hospital, for example, if somebody wants to observe how CMC's been functioning over the past 20 years, or you start today and then observe CMC for the next 10 years, and then check and talk about what's changing, how the mission values of CMC is held, and whether it's changing, etc. So that's a good way of doing longitudinal case study research in qualitative research. You can also do action research. This is very popular recently. So you actually include the participants in your research in the research itself. So it's not like a researcher standing and observing or interviewing someone. The participants also are part of the research process. So that's gaining lots of traction now. Qualitative interview studies, some of you have already mentioned. I'll use qualitative interview study as an example to talk a little bit more about the data collection and analysis. Discourse or conversation analysis was the example that I used to quantify qualitative research. So that's another research study that you can do as well. Lots of people also do focus groups, and it's very, very popular in market-based research. I'm sure lots of you are familiar with Delphi studies or modified Delphi studies. So that's a part of qualitative research as well. And Delphi studies are usually used to inform quantitative research in terms of, what survey questionnaire you can use, or developing a patient-reported outcome measure, etc. So Delphi studies are very useful in that. And like quantitative research, you can also do research synthesis in qualitative studies. So you can have meta synthesis, meta-ethnography, meta-analysis, etc. So meta-narrative synthesis, realist synthesis. There are lots of different types of synthesis that you can do with qualitative research as well. Again, those are just examples. I'm not going to go into too much detail on that for today. If you're doing health services research, like most of you, I'm assuming there are some students and interns in this group as well, and other OT staff and physio staff who may want to go off and do research using qualitative methods. Invariably, from our background, we're ending up doing health services research. We're not, not many of us are doing bench side research. We're not doing biomedical research. We're not researching on vaccine compounds or, tests for particular disease conditions. A lot of our research is meant to be in health services research. Hence why these questions, so, how effective has a particular intervention been in improving clinical outcomes and productivity, things like that. Or what was the planned change, what actually happened and why. So you're treating someone, say, with back pain, you've created a new intervention methodology, and then you want to test to see what happened, whether it actually made a difference or a change for that particular patient or group of patients. So you can use those type of questions to answer using qualitative research methods. By the way, I will send a copy of this slide deck in case you want to do read up further as well. And I've got a whole list of references just in case that's useful for you. Okay, back to Menti. So what different sources of qualitative data can you think of? So I'll bring up the Menti screen again, and let's see what you think are the different sources of qualitative data. Okay, we've said how to collect the data, so interview methods, ethnography, etc. But what do you think are the different sources of qualitative data? Where can you get the qualitative data from? I know some people have joined fairly newly. So in case you're not sure what to do, just go to this website called menti.com. And if you put this particular code in, you should be able to answer this question. Okay, participants, formal, informal discussion. Okay, interview, survey. Okay, different stakeholders, that's correct. Any more? Okay, observations, yeah. Okay, lots of discussions, questionnaires, A lot of the time, two people have mentioned survey and questionnaire. A lot of the time surveys are used in quantitative methodology, but if you leave it open-ended as a question, then some of the answers that you get from that survey, you can actually analyze using qualitative methods. So that's one way of collecting qualitative data. I'll stop this for now, and I'll share my screen again. Okay, okay, Reema, somebody has to confirm that that's gone back.
Yes, sir, it's visible.
Thank you. Thank you. So you're all right in terms of where you get the data from. So you can get it from interview or focus group. So you can actually ask people when you're talking to them, or you do it in a formal settings like an interview, and you analyze the transcripts of those interview data for qualitative analysis. You can also do observational ethnographic field notes. You can also get lots of qualitative data from documentary evidence. So if you're doing, based on like a systematic review, or if you're actually doing bench-side type research, desk-based research, you can actually look at, board reports or organization policies and, standard operating procedures, etc., to get some of the evidence as well. You can also look at, photographic evidence. You can look at how a particular workplace layout is. So, for example, you have a question on what is the most efficient way of arranging a room for wheelchair transfers, for example. So something like that, for a question like that, you might want to actually arrange different beds and then figure out whether that's how it's working. So you might want to do lots of planning and drawing diagrams of how a room layout is, etc., to actually do that particular type of research. And that's how you get the data for that. But I'm going to talk a lot about interviews and focus groups because that's most commonly used and that's what I'm more familiar with. So I'll use that as an example. So in sampling terms, again, comparing it to quantitative research, your sampling in quantitative research is normally predetermined. So you say, you use a power calculation, you try and find out how many people you want to include in your experiment, if it's an experimental study, and then you actually try and keep it as bias-free as possible. So if it's a randomized control trial, you try and blind the participants, blind the researcher, etc. So that's one way of doing it in quantitative research. Whereas in qualitative, because of the type of question that you want answered, the sample or the people that you're collecting data from will be very purposive. So you actually want, say, for example, you're doing research in attitude of women to mental health condition for a particular mental health condition. You already know the sample has to be women. And then you can actually, to get a wide variety of answers, you would try and ask some younger women, some older women. You would also choose some women who are married, who are not married. So you try and create a sample that is very varied if you want lots of varied input, and then collect the information from them. So you actually are saying, I want this in this particular category to be included in my sample, and then I'm going to go and actually sample them. I mentioned earlier on about theoretical sampling. So what happens is when you're collecting data, if you realize that, oh, this particular question needs to be answered because of the answers that some of the participants are giving you, you can revisit the question and try and change the sample. So for example, lots of people that you're interviewing, the women are saying, my husband says this, or my son says this. You suddenly realize that there might be an interest in trying and finding out a little bit more information from the men, even though the women are the primary sample source for you. So you might actually go and want to collect some more information from men at a later point. So you can actually use that to change or modify how you're collecting the data. And that's called theoretical sampling. So you actually come back and revisit it. Whereas theoretical saturation is slightly different in that when you actually start looking at data, when you're starting analyzing data, there are no new themes or no new material that you can use that you can see when you're analyzing the data. And at that point, you think, okay, I've got enough data to complete my analysis. I don't want to go back and actually re-examine this again. So you can stop data collection at that point. So that's a slight difference between theoretical sampling and theoretical saturation. Normally in qualitative interviews, the data collection is structured or semi-structured. Preferably you use semi-structured because it's very, very difficult to do unstructured data. It's not like you can go to a random stranger on the street and say, oh, I'm doing qualitative research. Tell me what you think about this. You'll want to structure it in a slight way. So you actually, you choose the population, you know whom you're going to ask a question. And more importantly, you want to ask them a particular question. So invariably it is unstructured or structured data collection, but structured data collection doesn't give you enough richness in the material that you're collecting or the answers that you want to know. So invariably, again, if you're using interviews, for example, as a technique, you would use unstructured or semi-structured questions. It helps you, categorize and stuff later if you're using a structured question, and that's what you would use in a survey data. So you'd ask a question like, how has this particular treatment helped you with pain? And you might have a visual scale that says 0 pain to 100 being the most painful. And then you can actually ask another follow-on question from that to say, can you describe what is the change or something like that? And then you can collect that data. So that's one way of doing structured data collection using a survey, for example. Some general guidance from me in terms of data collection, if you're planning to use interview as a methodology, make sure that you plan where the interview is happening, you have enough time to complete the interview. It's best always to record the interview. Normally you'd use like, a proper digital voice recorder, but if you don't have access to a voice recorder, you can use your mobile phone or something, but obviously, make sure that there's consent, etc. And then record the interview so that you can transcribe the interview fairly quickly after that. Other ways of doing it, if you don't have access to a phone or if you don't have access to a voice recorder, is to actually remember what they're saying. But again, over time, even if it's half an hour, 1 hour later, you actually might not remember the exact words they use or the exact concept that they were trying to convey to you. So it might be lost. So it's always better saying if you can't use a voice recorder or a phone to record the conversation. Sometimes if you have lots of resources, you can actually take another person as a scribe. So you're asking the questions. So you're not getting distracted by writing down what this person is saying because you want to keep the conversation going. So you can take somebody else along with you as a scribe to actually note down the answers. And like I was saying, a lot of the interviews are done as semi-structured interviews. So it's always nice to have a topic guide. So okay, this is a topic that I'm trying to research. These are the type of questions that I want to ask so that I can get the maximum amount of data from this particular interview participant or, the person that is giving me the answers. It also helps you standardize some of the data collection so that you're not forgetting to ask certain questions to certain people. So okay, I've got 5 questions that I want answers to. I can ask these 5 questions. So you're not actually forgetting to answer or ask question 3 or 4 to a particular person. It's always important, again, because it's a very, social environment. You're actually talking to people. So you need to make sure that you've established rapport, you're giving them some orientation time to what the research is about, why you're interested in doing that research, etc. So that the answers that they give flows freely. Otherwise, it'll be a very restricted question answer session, like an interview, like a job interview rather than, a data collection interview. Also, sometimes when you're asking a particular question to a person, they might be talking about very different things, or they might be going off in a tangent and not answering the questions that you want answers to. So it's very important to develop the skill of doing interviews properly as well. And that's a skill that you can develop, and it takes practice over time with different people. And it's a nice skill to practice with colleagues or, your supervisor or one of the staff members to actually practice to get that right, so that if somebody is veering off topic quite a bit, how do you bring them back gently? How do you keep them to answering the questions that you want to answer instead of, stopping them abruptly? How do you actually guide them back to the answers? There are different types of interview schedules that you can create, or interview topic guides that you can create. You can have lots of prompts added to the questions. I've sort of talk a little bit about different types of questions you want to ask and what prompts you can use. So if you're asking for, say, general descriptive questions, you can ask, can you describe? So you can ask, can you describe your pain? Or can you describe your experience of using something? Or can you describe your experience of being a patient in CMC? That sort of stuff. You can also ask questions that help people contrast. So you can ask, what do you think about being a patient in CMC hospital campus compared to being a patient in CMC college campus? So those are sort of questions you can ask as well, and those prompts will help you achieve the data collection well. You can also ask evaluative questions. So you can ask things like, how effective do you think this method is? Again, remember, this is their personal account of whether they think something is effective or not. So the effective word in this sense is not what you normally see in a quantitative study on effectiveness. So this is slightly different. It's their perception. It's their unique worldview of whether they think it's been effective or not. And that's equally important as well. It's about how do you ask the question and for what research question. I did say I'll give the slide deck. What I've done is I've gone through a nice study that Reema has done in mental health in the psych unit at CMC, asking about people's experiences of unemployment for people who live with severe and enduring mental illness. And these are the questions that she has asked as part of the question to people. So questions such as, what could be the benefits of work for someone with, mental illness? What could be some of the barriers for this work? So all those questions are evaluative questions. You can also ask people to contrast. So what difficulties do you think someone with physical mental illness have in performing work when compared with others? So you're asking them to compare it with someone else. You can also do some boundary probing questions. So you're slightly going beyond the immediate remit by asking them slightly outside the remit type questions. So things like, do you think mental illness can be classified as a disability? So that's a nice boundary probing question. So you can have different sets of questions. What you normally do in an interview type research study, in qualitative research, is have these questions pre-prepared. You would find the questions by doing some literature review. So going back to the graphic that I showed earlier, you'll identify these questions from the literature review, prepare these questions, maybe test it on like 1 or 2 people to check that the questions actually will work and will answer your particular research topic, and then use it in a population. So Reema, for example, in this study, used it in focus groups. You can use it in a one-to-one interview as well. Again, which one do you want to choose? Do you want to use an interview? Do you want to use a focus group? Depends on the resources that you have, the time that you have. How are you going to bring all these people together? How are you going to actually answer these questions? There might be some questions that are very private, so it's best to do one-to-one interviews in those type of situations. If they're not extremely private, then you can actually do it in focus groups. All of that depends on your research question and what you want to get out of analyzing those research answers as well. So certain things to avoid bias. Again, bias is very huge and very important in qualitative research. So you need to make sure that you're asking not leading questions. So, don't just ask them about negative aspects. Ask them about that experience, not just negative experiences. Or don't ask them closed questions. Don't say, did the treatment work for you or not? Then the answer might be, yes, it worked, or no, it did not work. Whereas if you ask, what was your experience of the treatment, you're likely to get much more verbose answers for that particular question. And because you're doing it in a focus group or in an interview, you're doing it face-to-face with someone, you can actually end up leading the interview with your body language, your facial expression as well. So try and actually make sure that your facial expressions are neutral. The expression that you want to convey is that you're interested in everything that they have to say, rather than just the ideas that you're keen on hearing. And nowadays, people are actually also doing telephone interviews, using Zoom and Skype interviews. I ended up doing for my PhD, I ended up doing a couple of, Zoom interviews. So it's about how do you modify and change that to allow them time to answer. There might be a slight delay in them looking at you and then answering, etc. So you need to factor those sort of things in as well. And remember, there's also lots of power relationships as well. There's a hierarchy. So you're a researcher and then they are a patient maybe. So they might be hesitant in answering certain questions. So what you want to do when you're setting up the room for the interview, for example, is make it neutral. So you're not sitting on a higher chair and they're not sitting somewhere lower down, or you're sitting on a chair and they are sitting on a floor, that sort of stuff. So you want to ensure that they don't have this power dynamics. And as a result, they don't answer less or more of your questions. And also be aware of your own perspective, and that's very important for minimizing bias in qualitative interviews. And you have to declare that. So if you're an OT researching something that's very OT specific, you have certain biases of what works and what doesn't work. So you need to be aware of that and mention that when you're actually writing up qualitative research as well, so that you try and minimize that as much as possible. And in most instances, when you're doing qualitative research, you would have someone else along with you when you're doing the data analysis, so that it's not just your interpretation of what's happening. You triangulate that with someone else and try and arrive at the same sort of common answer. So it's good practice to do it with more than one person. And also don't presume that all your preconceived topics are relevant. It might not be relevant. So if you're asking somebody about the experience of treatment, you might be interested in knowing costs for that treatment, whether that affects their experience. But to a patient, the cost might not be that important. It might be other smaller things like, transport, how do they get to the treatment facility, or, the number of people that are waiting to be seen before them. So waiting time at the clinic, etc. That might be more important rather than the cost. So make sure that you're asking questions that are relevant to the people as well. And also be flexible. Again, qualitative research is very rich. It's very, very, flexible. It's very iterative. So don't force people. Keep it fairly fluid, and that helps you minimize bias as well. Otherwise, what your interviewees will end up doing is close up and give you less information than what you want. So I'm going to help do a group exercise for maybe 5 minutes. So my research topic is on looking at how people use assistive technologies, mainly carers, so that's family, friends, and neighbors, help people with dementia stay safely at home by using assistive technology. There's some important gaps in this particular research area, hence why my PhD. And what I want to do is investigate carers' experience of using assistive technology in supporting and caring for someone with dementia who live at home. So that's my area of interest, basically. So in this particular thing, my phenomenon of interest is what is the experience of carers in looking at someone with dementia when they're using assistive technology. That's my area of interest. So if you have a pen or a paper, if you just write down that this is the research topic, so I want to know how family members, for example, experience using technology and what is their experience in using technology to support someone with dementia who live at home. So it's not in the care home, but in their own home. It's not in a nursing home or residential home. So this is the research question. I'll stop screen sharing for now. What I'm going to do is, depending on how many people we have about 36 people, so roughly about 5 per group. So if we do 7 breakout groups, that's the question you're going to answer. So you're going to answer. Sorry.
You've muted yourself.
No, sorry, my apologies. So I was saying, I'm going to divide people in this group into 7 different breakout groups for about 5 minutes, so you can go back and discuss this particular research question. You're going to look at what should be the research question to understand how carers use assistive technology in dementia care. You're going to also think about the sample. So whom are you going to answer, get the answers from? So what should be the inclusion criteria? What should be the exclusion criteria? You also want to think about how to collect the data. Do you want to do a focus group or interview or observation, etc.? So that will be the other question. And then we'll come back again and maybe share your thoughts on what you think are the best ways to collect the information, who are the best people to collect the information from, and what technique to use to collect the information. And then we'll talk about the analysis bit in a bit. Is that clear? Anyone who's not clear, just unmute yourself and ask me, and then I'll clarify. I'm going to create 7 breakout rooms. In a second, you should have an option on your screen that is asking you to, oh, lots of participants already left. So I'll reduce the number of groups. Maybe it's because I said you have to go to breakout groups. Okay, about 5 in each group. and then let's say come back in 5 minutes. I'll close the breakout room so you'll be able to come back automatically. So you don't need to do anything. Just stay in the breakout group, have a quick discussion, and I'm assigning you randomly, so you might not be with people that you really want to be. Sorry about that. Let's take 5 minutes and come back. Free to unmute yourself and see if you can answer some of these questions. So whichever group wants to go, tell us what you think should be the research focus. So what should be the research question? Anybody did that? Unmute yourself and go for it. Okay.
Stuti, sir, I'll go.
Oh yeah. Sure,
So we were in group 6. We discussed, so our inclusion criteria, we discussed it to be the immediate or primary caregiver, and we believed it should be a primary caregiver of a person with moderate to severe dementia. And the method we preferred would be having a combination of focus group discussions and interviews to go along with it. And the research question that we thought could be a good.
Okay, sorry, I've lost you for some reason.
Yeah, I think we have all lost her.
Okay, that's fine. But good points. Anybody else had any differing opinion in terms of who should we ask the questions to? I actually have prepared what the question should be in the first instance. So what are the types of assistive technology that people are being used, that people are using? So we want to know that, and then what type of, what do carers use and prefer using? And we also want to know what are the facilitators and barriers for using that. So that'll be like the research focused question. And then I agree with what Stuti was saying in terms of who should be included. So adults, carers, one thing I think she missed, maybe she would have mentioned it if she hadn't gotten cut off, was how have they used at least one assistive technology, because we want to know their experience of using it. So you want to make sure that they've used at least one of these technologies. And because, you know, I'm going to conduct the interview in English, so I want to know if they can speak in English, but obviously, you know, it could be in Tamil or Hindi or whatever, depending on your expertise in that particular language and how you want to use that. And then most importantly, you want the person with dementia still living at home rather than in a care home or in a nursing home, etc., so that you can actually get that lived experience bit again. Okay, so anyone had thoughts on what sort of, or how to collect the data? How will you go about collecting the data? Anybody had thoughts on that? I understand from Joshua, someone called Nisha made some notes.
Yes, we made more of the interview questions that we would be asking.
Sure, go for it. So you want to do an interview?
Yes, sir.
Okay, go for it.
So the main questions that we thought of asking them would be whether they do use AT devices or not. Okay. And if they do use it, so what is the frequency that they use it and how long have they used it? Okay. If they have AT devices but they do not use it, we want to know why they do not comply. And okay. How a follow-up question could be how would we be able to improve the compliance in use of the devices.
Okay, cool.
And then other questions would be are the patients the ones who are using it, or are the caregivers the ones who are using it?
Perfect, that's a good question. Good.
What are the
or maybe they're using it together. That could be another
yes.
question as well.
Yes, then the type of AT devices that they're using and who is funding for it. Then the experience in maintenance of the device and situations where they found it useful, and whether if supposing the patient or the caregiver is not able to use it, are there any external people able to use it? And then I think if supposing they had to, while purchasing the device, if supposing like how long they had to wait to get it, and what is the durability of the device?
Okay, brilliant. You've sort of covered everything that I wanted to cover. Very good. Thank you very much for that, Nisha.
Thank you.
So you're using an interview, so you could also collect it by focus group. So because you're not asking extremely sensitive questions as part of this particular set of questions that you've been asking. There were not very many sensitive questions. You could actually collect it by doing focus groups as well. But in the interview, you can ask slightly more probing questions. You could ask, some sensitive issues as well in terms of, how much it costs and whether they can afford it, etc. type questions. It might be easier to collect it if you're doing a one-to-one interview rather than doing it in a focus group. So that's another thing. You would not want to do something like ethnography unless you want to know how exactly they're using it. So the question, if it had been instead of experience of using assistive technology, if the question had been how are they using assistive technology, then you can actually do some observational stuff. So you do ethnography. So you'd go and spend a day with the carer and say, answering your question of, whether the person with dementia is using it or the carer is using it or they're using it together, and the frequency of using it, etc. So those sort of questions you can also answer by doing an ethnographic study, but that's not the question here. So ideally, like what you said, you would do user interview and then try and get the answers for that question. Brilliant, thanks for that. I'm assuming others had similar answers. If you had any answers or thoughts or suggestions that was extremely different to what Nisha and Stuti were sharing, what I was saying, I'd be very interested in hearing that. If it's a question that you have, again, this is not like a marked teaching session or anything. So even if it seems stupid to you, do raise that as a question, because it's nice to share that information because you may actually be right. Any other thoughts or comments from anyone?
Vimal, so our group had some discussion, and one of the things that came up was the duration of dementia that they had.
Okay.
So in terms of chronicity, so probably there, if you could get people from different chronic, different duration that they've been suffering.
Yeah.
And also, we just started off a discussion thinking, can we think beyond the caregiver and the individual? Like someone in the community, for example, maybe a pharmacist in a shop who's serving people with dementia.
Yeah.
But we didn't have a consensus on that, but it was just an idea that floated through in the discussion.
Brilliant. That's good questions, actually, for this particular thing, because we're interested in answering issues from the perspective of carers, including someone from the community for this particular question may not be needed. But as a context-specific thing, because you're situating this in their own, people living in their own homes, so they have to actually maybe access pharmacists, etc. So it actually makes sense to include that as an extension to the study to collect slightly more or more richer information. So that's a good point. And you're very right in terms of considering duration that the person with dementia has had dementia. So how long have they had it for? Does that influence how the technology is being used and why is it being used for, etc.? So that's a good question. So you tackle that in your selection of participants. So you'd select people who have just recently been diagnosed with dementia. You'd select participants who've had dementia diagnosed maybe 3-5 years ago, and try and choose the carers for those type of people as well, so that you get a large spread of people who can give you that richness of information. So that's very important as well. Thanks for picking that up. Brilliant. So you're all good qualitative researchers already. I'll move on. So in terms of now you've collected the data, how do you analyze it? So there are different ways of analyzing qualitative data. So one way that I'm going to talk about a little bit more in detail is thematic analysis. That's one way of analyzing data. You also have something called as framework or template analysis. You have content analysis, which is the quantitative element in qualitative analysis. So going back to the analysis of language that we use in terms of COVID as an example. So that's where you would do content analysis, and it can be a very quantitative methodology. You have something called as grounded theory in analysis as well. And in grounded theory, what you're trying to do is using data to create a theory. So you're trying to create a hypothesis. So you'd use grounded theory. You can also use discourse analysis. Again, discourse analysis is language analysis. So you say, you analyze the transcript of your interview and then say how many times are they pausing, what are the nonverbal reactions that they're having, what are the verbal reactions that they're having, how often are they pausing to think about something, how easily does the answer come to them. So you can analyze all of that as well as analyzing the themes that come from it. And you can also do a case study analysis as well in terms of, you can specify the context in which you're analyzing and then triangulate it based on the type of people that you're doing your research with, the researcher who's doing the research, and the context in which the research is happening. So you can do that as well. I'm going to talk a little bit about thematic analysis. So normally in thematic analysis, you'll follow 6 steps. So you take the data that you've done through interview or focus group. So let's assume interview for now. You take the data and then you fragment it into meaningful units. So you look at what they're saying and then try and identify what exactly are they referring to. And then you do a process called open coding. So you try and describe what they're saying. So for example, if somebody who's got hip pain and they're talking about pain and saying, oh, I have more pain in the morning, but if I start working a little bit during the day, my pain disappears. So you code it you can code it in multiple ways. You can code a thing about pain and how much they're experiencing pain. You can also talk about pain being transient because it's more in the morning and becomes less during the day. They're also describing another code in that sentence itself in terms of by doing more work, they experience less pain. So maybe they're using it as a distraction technique to reduce the amount of pain they're experiencing. So you can code it in different ways. So you'll start unpicking each sentence in the data and then try and code it. Once you've done lots of different coding, you can start organizing these codes into different categories. And once those categories start coming up, you can organize them into hierarchies in different groups. So what in essence you're doing is you're saying, okay, somebody's talking about pain, somebody's talking about medication, somebody's talking about non-pharmaceutical relief for pain, somebody's talking about distraction techniques. So you have different groups that you can put all these codes they've been creating into. And then what you do, and this is the most important, the more complex bit in qualitative analysis, is you're trying to search for links between these different categories. And then based on these different categories, you actually bring them together into different themes. And then you talk about what is happening. So you generate some theory, you're creating a particular answer to your research question, etc. So that's the last step. So in thematic analysis, what happens is you identify different themes, you refine them from different other themes. So it has to be mutually exclusive. But it can be hierarchical. So you can have a theme and you can have some sub-themes under that particular theme. I'll give you an example in a minute. And then you continue analysis until all the data fragments in your particular interview is accounted for. And normally in qualitative research, if it's an interview study, you would do about 20, maybe 25 interviews. And that in itself is a massive exercise. Imagine you have to go and read line by line, try and do the coding and try and come back and do a different coding and then try and put them into categories. And then from the categories, you have to put them into themes. So it's a massive exercise. So it's very important that you don't miss out important information that might be on the sidelines, but actually might be much more important when you actually classify them into different themes. So, it takes lots of time to do qualitative analysis. And thematic analysis, lots of people in research papers, especially in the old research papers, if we look at it, somebody would have said, oh, we use thematic analysis as a methodology. But the clue is in the name, isn't it? You're actually analyzing data. So that's an analysis technique rather than actual methodology. So this is one example of a study that I'm doing as part of my PhD. This is looking at, how do people who are looking after somebody with dementia experiences lockdown in the UK, for example. So what I would do is I've imported into a particular software called NVivo. There are other softwares for qualitative analysis as well. Reema actually pointed out a lovely software that they've been using in CMC called QuirkCos, and it's quite, very nice software. It's not extremely expensive. But if you have an institutional license, you can use QuirkCos, or you can use NVivo, etc. So similar to in quantitative, you'd use SPSS or Stata or R, something like that. You also can, you don't need software to do the analysis. You can actually use Post-it notes, that sort of stuff as well. Or you can use Excel sheets, which is what Reema used in her study to actually bring out the codes and put them into themes as well. So you can use multiple different ways. So what I would do in thematic analysis, I would go and read. So this says about I arrange carers if I've got an appointment or I'm going to meet up with friends. That hasn't happened so much with the virus. So she's talking about COVID-19 virus. But I did have regular outings, and then I would pay for carers to come in and sit with them. So in that particular thing, she's talking about help from formal carers and how she's using that help. So I would actually code that, and I've already been creating codes. So this is participant 11. So by this time, I've got codes from lots of other participants. I had 23 participants from our study for this particular study. So I would move that. I'll highlight that, and I'll move that as a code to impact of COVID additional support. That's one of the sub-themes that I had. So I'll bring all of this together and there'll be, so this is another example of all the themes and sub-themes. And then, so once I've generated these categories, I'll go and look for connections between them and try and organize them into, mutually exclusive themes and some sub-themes that sit under them. So in this particular paper, we had, impact of COVID on additional support that they receive, impact, whether it had no impact or whether it had physical impact or impact on the mental health or physical health, and what is the impact on their social life, etc. So those were the themes and sub-themes. That's how I would classify this particular codes. So there are different ways of doing it, slightly different ways of doing it. So Reema, in her particular analysis, she's written up what she's done. So this is again the reference from Reema in terms of, she's used a particular approach guided by Brown and Clark. So they have like, absolute legends and qualitative thematic analysis. So she's used that thing, which is a 6-step approach. And, those 6 steps are very similar to the 6-step approach that I described earlier in terms of coding and categorizing, bringing out themes, and then situating them in hierarchies. So that's what she's done. So this is another paper from me. So this is another study that I published in Qualitative Research in BMJ Open. So I use a slightly different process that was talked about by Lindseth and Norberg. So they used 3 different steps in terms of not just analyzing the what they're saying, but also analyzing it in context. So trying to put it into context. So that's very important as well. The context thing is actually important in terms of lots of qualitative research. I'm just going to ask quick questions. So again, feel free to unmute your mic and answer this. If I say the word, you say, for example, a participant in an interview, I'm not telling you the context for the interview for now, but you hear the word or you're reading a transcript and the word chair comes up, C-H-A-I-R, chair. What would your interpretation be? What is this person talking about? Anybody? Just feel free to unmute your mic and shout out some answers. Chair. Yeah.
The leader?
Sorry?
The leader?
Okay, leader. Okay, that's a good point. Yeah. Anything else? Anybody else? What else would you
conducts this study, sir?
Sorry?
The person who conducts this study.
Okay, the person who's conducting the study. Okay. Anything else? With the researcher, it could be. If you're just reading a transcript and it says chair and there's a mention about chair, what would you interpret it as?
Something to sit on, sir.
Oh, good. So it could be furniture. It could be, a normal chair or dining chair. It could be a chair in the garden. It could be anywhere. It could be a piece of furniture. But it also could be something like Joshua and someone else was talking about. It could be talking about the researcher or the leader. And in an academic context, so if the research was happening in an academic context, it would be chair of, acute medicine or chair of medicine or something like that. So it could be an academic post that someone is holding. So context becomes very important, and you have to make sure that in your qualitative analysis, the context is actually explained very clearly. So we're researching in participants and you're asking them about, OPD and how people are sitting in OPD. You have to mention that so that the chair that's being mentioned there, people know that is chairs that people sit on. Whereas if the research is being carried out in an academic context and you're asking about, professorships and how people experience becoming a professor or something like that, then that might be people talking about, academic chairs or research chairs or leaders, etc. So it is important to specify the context when you're doing qualitative analysis and writing it up, just as a slight aside, just so you remember. And normally when you're writing up qualitative research, again, you mention what you found and then use some illustrative quotes for that. So in this example, again, I've used Reema's example. So she's talking about this agreement both within as well as between all 3 groups of participants that employment for men is more important as it is considered as man's responsibility to work irrespective of illness. So this is in an Indian context, so you have to remember that. And then she's using some examples to say why she made that statement as a finding from her research. So the statement that somebody in the focus group is talking about is, it's a man's responsibility to be busy and work and to read the paper and other resources to more about employment opportunities. So that's something the participant has said, hence why she's making this particular finding from her research. So normally you would write what you found and then use an example from a direct quote from someone to illustrate that example. And, again, go back and read Reema's paper. It's quite well written as an example if you want to look at how to write it for a manuscript or for a journal. Like quantitative research, you have reporting guidelines. So if you're doing a systematic review, you would do PRISMA. If you're doing a qualitative, quality improvement study, you would do SQUIRE guidelines, etc. So qualitative research, you can use two different reporting guidelines. So there's one called the Standards of Reporting Qualitative Research Synthesis of Recommendations. And the other one, which I personally prefer, is the Core Q, which is a 32-item checklist to say whether you've covered every aspect that you need to cover. And you can find that in this particular Equator website if you want it as a checklist to use when you're submitting your manuscript. I've put lots of references in case you're interested. I will send this to Reema. I've already sent it to Reema, so she can forward it on to you if you're interested. And I'll stop now. I'm very conscious that I've taken more time than was allocated to me, but I'm hoping that was useful. Did you have any questions? Again, feel free to unmute, shout out questions. There are a few qualitative researchers within the alumni groups, Reema for one, I Can Help, and people like Mani or my classmate Raj. We've all done and published papers in qualitative research. So if anybody's looking to do as part of your final year student project or something, you have questions and stuff, feel free to reach out. We'll happily help with that. Shall I stop recording for now? Or someone who's recording can stop. Cool. Any questions from anybody else?